The new 2021 Medicare and You Handbook just came out. This video will be outlining the changes for you, and there's some good changes that are going on. There will also be a link in the description for you to download your own copy as well. This video, it isn't a full outline of the 2021 Medicare and You Handbook, but a quick look at what Medicare has changed. I haven't had time yet to fully go through and read the whole book yet this year. I read this every year to keep up with the changes so I can help you stay informed. But Medicare is nice enough to put in the front what has changed. Some of the changes that Medicare has made, I have already made detailed videos and articles for my subscribers to my YouTube channel and Facebook page for changes that were announced earlier this year. Hi, Chris Duncan here again. I'm an independent Medicare insurance broker and I run Trusted Benefits Direct. If this video helps you, please like and share this video. It really helps me with Facebook, YouTube, and Google for me to reach more people that need my free help. Also, subscribe to my YouTube channel and like my Facebook page for the most recent updates. The changes are outlined right on the second page of the handbook. These changes are, as you can see, first about COVID-19, and they advise you to contact Medicare for more info if you need it. Second, and I believe the most important, is the lowering of the cost of insulin through what is called the senior savings model. I have an article and video that I produced when this was first announced a few months back. If you take insulin, you will want to make sure and at least watch this portion of my video in a little bit. Now, not all Part D plans are participating in the reduced insulin costs, but some Part D plans inside some Medicare Advantage plans are providing many different insulins at a $0 copayment for you. Next on the list is End Stage Renal Disease, ESRD, for example, kidney dialysis. If you have end-stage renal disease, you can join a Medicare Advantage plan now during the open enrollment from October 15th to December 7th for a January 1st, 2021 effective date. This is brand new. Before, there was a rule not allowing Medicare beneficiaries with ESRD in Medicare Advantage plans unless it was a special plan for end-stage renal disease. Another change, Medicare is now covering acupuncture. This is something I covered a few months back as well with an article and a video. Medicare will now cover acupuncture for chronic lower back pain. Look in the description for a link to this video. Or if you look in the top right-hand corner, and I hope I'm pointing in the right spot because when you edit these videos, it's actually mirrored. So hopefully, I'm using my left hand here to point. Hopefully that's right. But there should be appearing a card right up here. And that video, or excuse me, that card can take you directly to that video. And last, Medicare has also added telehealth and other virtual services as well. You can get help with your Medicare choices through Medicare's website, or you can look up plan choices through my websites. For Part D prescription coverage, go to PartD.now.com, and for Medicare Advantage, go to MedicareAdvantageStore.com. On my sites, not all the plans are listed. The plans listed are plans I have vetted and wish to do business with. Companies I have deemed as having strong customer service and benefits, amongst other things as well. If you'd like to view all of the plans, you can go directly to Medicare's website for that. First on the list we will hit is lower insulin costs. It reads on page 84 under the heading Senior Savings Model. You may be able to join a drug plan that gives supplemental benefits for insulin starting January 1st, 2021. The Part D Senior Savings Model is available to all people with Medicare. Plans that participate in this model will offer coverage choices that include multiple types of insulin at a maximum copayment of $35 for a 30-day supply. Notice it says maximum copayment of $35. I'll hit back on that here in a moment. People who enroll in a participating plan could save up to $446 a year in out-of-pocket costs. Visit medicare.gov/plan-compare to find a participating plan in your state. I have written a more in-depth article and video about this. Look in the description for links to that information. What this doesn't mention, and is extremely important to know in my opinion, is not every Part D plan is participating in the senior savings model. It is totally optional by the plans. If you don't work with an independent agent to help you search, I could certainly help you with that search. If you'd like to start the investigation on your own, you can use my website. Again, that's PartD.now.com. And also on my sites, as I said, these are the plans that I represent. These are plans I have vetted and chosen to do business with. I don't work with all of the plans for various reasons. If you'd like to look at all the plans, you can go to Medicare's website for that. I also would like to hit upon insulin savings that are available in the Part D coverage of some Medicare Advantage plans. If you notice the verbiage in the quote, it says a maximum copayment of $35 for a 30-day supply. There are some Medicare Advantage plans that are offering many insulins at a $0 copay for a 30-day supply. This is something your independent agent can help you with the most. If you don't have an agent, I would love the opportunity to become your agent. Together, I can help you find the exact right plan to fit your specific needs. This next one on the list is a big one as well. This is about Medicare Advantage and End Stage Renal Disease, ESRD, for example, kidney dialysis. This was signed into law a few years back and goes into effect January 1st, 2021. Before the law, there was one health question on a Medicare Advantage application. The question was about end-stage renal disease. If the applicant did have ESRD, they were not eligible for the plan. Now, with this law that is going into effect, Medicare Advantage plans can no longer ask if the applicant has end-stage renal disease. Now, there are no medical underwriting questions to ask on a Medicare Advantage plan. If you or someone you know or love has ESRD, they can now enroll into a Medicare Advantage plan. They can do this between October 15th to December 7th for a January 1st effective date. And with another shameless plug for my services, I can help you find a plan that satisfies your needs in all 50 states. There will likely be copays on the plan, but now there is the protection of a maximum out-of-pocket. When someone has original Medicare without a supplement, there is no maximum out-of-pocket protection. The cost can be unlimited. When someone has a Medicare supplement, the supplement can help pay for what original Medicare doesn't pay for. With a Medicare Advantage plan, the law states each plan must have a maximum out-of-pocket the member can spend in deductibles, co-pays, co-insurance, etc. Then the plan must pick up 100% of the medical costs. My services for you, they can help you shop for these plans independently. And by the way, my service doesn't cost you a dime. We have some plans with a maximum out-of-pocket for Medicare Advantage as low as $999 a calendar year. Moving along on our list is acupuncture. Original Medicare in the past didn't cover any acupuncture. However, now they have added some coverage for chronic low back pain. The details are located on page 30 under the heading Acupuncture for back pain. It states, Medicare covers up to 12 acupuncture visits in 90 days for chronic low back pain. This is defined as lasting 12 weeks or longer, having no known cause, not related to cancer that has spread, inflammatory, or infectious disease, pain not associated with surgery or pregnancy. Medicare covers an additional 8 sessions if you show improvement. If your doctor decides your chronic low back pain isn't improving or is getting worse, then Medicare won't cover your treatments. No more than 20 acupuncture treatments can be given yearly. And as a note, it says Medicare doesn't cover acupuncture for any condition other than chronic low back pain. For more details, I wrote an article and made a video about Medicare and acupuncture a few months back when this was first announced. Link to the articles and videos will be provided in the description below. Last on the list to cover is telehealth and other virtual services. As I'm sure you are aware, with everything going on with COVID, there are more and more people, not just seniors, having medical appointments via the telephone and video. This obviously is something Medicare has expanded. Let's take a look at how Medicare explains this. The notes that they put for us are on pages 39, 48, and 50. Here's what is on page 39 under the heading E-Visits. Medicare covers e-visits to allow you to talk with your doctor using an online patient portal without going to the doctor's office. Providers who can offer these services include doctors, nurse practitioners, physician assistants, physical therapists, occupational therapists, speech-language pathologists, licensed clinical social workers, and clinical psychologists. You must talk to your doctor or other provider to start these type of services. Next on page 8 goes on to talk about under the heading Telehealth Limited. Medicare covers telehealth services provided by a doctor or other health care provider who's located elsewhere using interactive, two-way, real-time audio and video technology. Telehealth can provide many services that generally occur in person, including office visits, psychotherapy, consultations, and certain other medical or health services, but only when you're at an office or other medical facility located in a rural area. You can get certain Medicare telehealth services without being in a rural healthcare setting, including monthly end-stage renal disease, ESRD visits for home dialysis, services for diagnosis, evaluation, or treatment of symptoms of an acute stroke wherever you are, including in a mobile stroke unit, services to treat a substance use disorder or a co-occurring mental health disorder in your home. For most of these services, you'll pay the same amount you would if you got the services in person. If you have a Medicare supplement, this can pay for the balance Medicare doesn't pay for. Last, on page 50 under the heading Virtual Check-ins. Medicare covers virtual check-ins with your doctor or certain other providers, like nurse practitioners or physician assistants using a device like your phone or integrated audio-video system. Your doctor can also conduct remote assessments using video or photo images you send for review to see whether you need to go to the doctor's office. Your doctor or other provider can respond to you by phone, audio visit, secure text message, email, or patient portal. You can use these services if you have met these conditions. You have talked to your doctor or other provider about starting these types of visits. The virtual check-in must not be related to a medical visit within the past 7 days and must not lead to the medical visit within the next 24 hours or the soonest appointment available. You must verbally consent to the virtual check-in, and your consent must be documented in your medical record. Your doctor may get one consent for a year's worth of these services. I know these are kind of confusing, but I would imagine your doctor or a provider that you see via telehealth and other services, virtual visits, will be able to answer your questions. That takes us to the end of another Medicare video. Again, I'm Chris Duncan. I run Trusted Benefits Direct, an independent Medicare agency. If I can help you find a plan to fit your needs, please contact me. We work with Medicare supplements, Medicare Advantage, Part D prescriptions, and a lot more as well. The easiest way to contact me is toll-free at 800-910-3382. Or if there is a button around this video, depending on where you are watching, go ahead and click on the button to be taken to my website where there is a secure contact form to fill out. Any info you provide is only sent to me. Many sites will actually sell your contact information. When you submit your contact info on many sites, if you read the fine print, you agree to have your info sold to third parties, and you consent to have them robocall you as well, amongst other things. None of those things happen with me. I don't have time for those shenanigans. Your info only comes to me, and I don't provide it to anyone else. If this video helped you, please do me a big favor and like the video and also share it. This really helps me with YouTube, Facebook, Google, and more for more people to find my free help. Also, don't forget to subscribe to my YouTube channel and like my Facebook page. This will help you stay up to date with other important information. Thanks for watching, and I'll be seeing you in the next video.